Numbers on the opioid epidemic, of course, are staggering, but new data from health researcher IQVIA show that they may be heading in the right direction. The volume of prescribed opioid painkillers last year declined by 17%, to the equivalent of about 34 pills per American adult. And that's the biggest decline on record, and it still sounds like a big number. The data show that opioid prescriptions peaked in 2011 at about 72 pills per adult. The decline was largely driven by fewer high-dose prescriptions, which are associated with a greater risk of addiction and overdose.
There's an overall much greater level of awareness of some of the risks of prescribing opioids. And there have been restrictions put in place really across the board to try to reduce particularly the use of the high-dose prescriptions.
Now, the study also shows an uptake in medication-assisted treatment for opioid addiction, something that researchers say is key for making a dent in the epidemic. But of course, opioid overdose deaths are now largely driven by use of illicit drugs like fentanyl. But researchers say curbing use of prescription opioids is an important step in the right direction, guys.
Meg, thanks very much. Stay right here. For more on the opioid crisis, let's bring in our guest. Joining us now is former FDA Commissioner and CNBC contributor, Dr. Scott Gottlieb. And Doctor, thanks for being here.
Thanks for having me.
It is good news, but what should we be kind of looking at around the edges on this?
Yeah, very good news, obviously. A lot of the addiction that historically has been formed in the medical setting from people who were prescribed a lawful prescription and became medically addicted. But a lot of the new addiction now is shifting to illicit drugs. People who are going online buying what they think is Percocet or Vicodin or even Xanax and are actually getting pressed fentanyl. So a lot of the addiction is shifting to the illicit drugs. And so I think we need to recognize that the nature of this entire addiction crisis is now evolving. The other thing we also need to be mindful of is that if you talk to the guys at DEA, what they're most worried about right now, or very worried about, is the methamphetamine crisis. And so that's starting to burgeon again, and that's methamphetamine, synthetic methamphetamine coming in from Mexico. So we need to just be mindful that these addiction crises are evolving.
The people who are looking for fentanyl or using fentanyl or buying things online, are those people who were originally addicted because of legal prescriptions for the most part?
Both, but if you look at the rates of new addiction, so historically the people who became newly addicted to opioids became addicted through a lawful prescription. A lot of the new addiction was from medical prescribing. More and more of the new addiction are actually people whose first exposure is going to be an illicit drug. So the nature of the crisis is evolving. So we need to just be focused on that. For the first time, FDA and Customs and Border Protection are working together to actually test the illicit flows into this country of fentanyl, and they're going to report it not in poundage, which is how it gets reported right now, but actually in the potency of those products. And I think the statistics are going to be overwhelming of the potency of the fentanyl that's coming into the U.S.
Because trying to measure it in pounds, as it's been done in the past, is nothing when you're dealing with something that is so toxic.
Right. I mean, if you're talking about marijuana, it was measured in pounds historically, and so that was customary in terms of how Customs and Border Protection reported their seizures. Really what matters is the morphine equivalents and how potent these formulations are, and they're super potent.
Wait a minute, pot was measured in ounces, right, Andrew? Didn't we?
I don't even know how you measure any of that.
It was ounces, man. I remember, right?
I only watch the movies.
Huh?
Well, the seizures were in pounds. Maybe you measured in ounces.
That was always the unit of measurement I was
Let's bring up the China trade talks, only because fentanyl has actually come up in these Chinese trade talks. Is that something where we could make a real dent in this if that is included as part of what we see, if there's a truce?
Absolutely, if China cracks down, and they've scheduled a lot of these substances in the host country, and a lot of the flows do come in from China. They come in through the international mail facilities. They're not just coming across the border. And so at FDA, when I was working there, we really stepped up the interdiction work that we were doing in international mail facilities. But there's so much coming in right now that it's hard to control it just by trying to control these flows.
What do you see as the most crucial step that the government can take to try to stop either of these epidemics, opioids or methamphetamines, as you're talking about? Is the government currently doing enough on all fronts, or should it be doing more, and what does it need to be doing?
You know, the biggest challenge that I see is that we're always fighting the last problem. We're not focused on where the addiction crises are evolving. When you're dealing with a burgeoning addiction crisis, you're always dealing with imperfect information. You're always one step behind. So I think it behooves us to try to be more aggressive than we otherwise might be in these kinds of settings. It's also why we were aggressive with the nicotine crisis relative to kids, because we were trying to get ahead of a crisis where we had imperfect information about just what the sheer scope of it was. So right now, what we need to be considering is the fact that there is a burgeoning crisis with methamphetamine and illicit fentanyl, and we're still focused on the crisis associated with medical prescribing. And I'm not saying we shouldn't be focused on that as well. That still is a major public health problem, but we can't be focused on that at the expense of where the crisis is evolving to.
Why is meth coming back? I mean, I thought we kind of cracked down on that. You can't even buy some of these, like Sudafed or some of these things over the counter.
So it's synthetic methamphetamine now. Before, people were manufacturing it off of pseudoephedrine. Now it's synthetic methamphetamine coming in from Mexico. Because unfortunately, Americans are going to find something to abuse, and so we're going to be moving from one crisis of addiction to another. But we need to be focused on where these things are evolving. Again, if you talk to the folks at the DEA, they'll tell you about the scope of the methamphetamine problem right now, but you don't see that in the newspaper. We're focused on, the historical problem, which is still a problem, which is the medical prescribing of opioids.
Walmart saying that it's going to be raising the age that it sells cigarettes to its customers to 21. What do you think of that?
Very positive step. Look, the large national retailers need to conform to a national consensus around age, and most states are moving to 21. So I think it behooves them to try to move towards the same age for their own compliance purposes. That's not to say this isn't a very positive step. The one thing that was disappointing, though, is that Walmart's taking the flavored e-cigarettes out of their stores, which I think is positive because we know the kids are using those flavored products, but they're leaving in the flavored tobacco products. So they're leaving in menthol cigarettes. So what you're going to have is you're going to have mentholated cigarettes, combustible tobacco, but you won't have the mentholated e-cigarette products. My preference would be to bias the market in the direction of the non-combustible products. So if you're going to take the flavored e-cigarettes out of the store, also take the flavored cigarettes out of the store.
You don't have flavored cigarettes like you had the e-cigarettes, though, right? It's
not the same.
Melon flavors or all these different flavors they were doing in e-cigarettes.
So those were banned under the Tobacco Control Act. So Congress took those out of the market, but we still have mentholated cigarettes on the market. But now if you walk into a Walmart store, you won't have the option of buying a mentholated e-cigarette. So for that adult consumer who might be using a mentholated combustible cigarette, they might be less likely to switch now to a non-combustible product. My preference, again, is to always bias the market in favor of the less harmful products. And we know the non-combustibles are less harmful.
That is a very in-depth sort of message, kind of digging through the layers on it.